Available statistics indicate that Nigeria has the second largest HIV epidemic in the world and one of the highest rates of new infections in Sub-Saharan Africa. As the National Agency for the Control of Aids NACA continues to work assiduously to change the narrative, the greater risk observers believe remains the low level of access to treatment, which is largely attributed to many AIDS-related deaths in the country. As Nigeria joins the rest of the world to observe the World AIDS Day, NACA says its greatest challenge in the fight against disease is the number of persons yet to know their HIV status. Speaking at an event to observe the day in Abuja, NACA Director General Dr. Gambo Aliyu indicated plans by the agency to end all forms of inequality and upscale its enlightenment campaign to bring more positive persons, especially pregnant women, on board.
We don't have cure for HIV, but we can really give HIV the fight it deserves. And we're doing that. We're keeping HIV, and denying HIV the opportunity to go around. And we are also denying HIV the activity to destroy that defense mechanism that the body has to make a person look sick or to even kill. Our effort now is identifying those people, that may be having this virus, but are unaware, or they are aware they're having this virus, but they didn't share that information with us. And because they didn't share that information with us, the service we provide, doesn't reach them in whatever way they don't access it. So these are the people that we're worried about, not the people we have identified that we put on treatment. Those ones, we are watching them and we're looking at them closely to make sure that that virus doesn't rear its head.
On her part, the coordinator of the National AIDS Sexually Transmitted Infections Control and Hepatitis Program, Dr. Ipazu Akudo, raised concerns for prevention of mother-to-child transmission and epidemic control.
Going to the target, which is the elimination of mother-to-child transmission. And that target requires us to increase ANC coverage and have women have at least one visit. Up to 95% of women have at least one visit. Coverage of testing for pregnant women over 95%. And ART coverage for pregnant positive women over 95%. We need to have less than 50 new pediatric infections per 100,000 live births. And we also need to have less than 5% mother-to-child transmission rates. That is actually our target.
Meanwhile, summary of other speakers' presentation indicated more push by all stakeholders in the fight against HIV/AIDS.
The HIV epidemic can only truly be addressed when people in our communities actually understand the urgency of these issues, but also have the right mindset and perceptions about issues around HIV.
We know the extent of funding available to HIV interventions in Nigeria today. You know that most of it comes from our donor partners. About 81% of it actually, and we have an idea that this funding, the total funding requirement, ranges between $300 to $500 million per annum. We also are aware that for 2021 to 2025, we have signed a new Global Fund grant for $329 million, but there's a shortfall. There's a significant shortfall. Based on our National HIV Strategic Plan, and we estimate that such shortfall to be about 20% of the required funding.
We need to invest in AYPs actually knowing their status. So increased level of comprehensive knowledge on HIV prevention amongst them, from 43% for female AYPs and 34% for males. So slightly more females know more about their status than the males do. As of 2020, but the idea is to get to that 90 target level.
The theme of the 2021 World AIDS Day is End Inequalities, End AIDS through Sustainable Financing. CNA News.